She's produced some studies and written papers on the level of trauma that a lot of mothers having given birth to a child with fetal alcohol spectrum disorders, the level of emergency room visits and damage done to their body before they were pregnant. And
Yep.
it just shows some of the other factors, and this trauma is a big one.
It's
Mhm.
huge.
Yeah.
It's massive. And it was recognized in certain efforts to create women-centric treatment modalities. For example, those in Boston, I visited them in the 90s, where there were researchers I was following. And because I was working in the research program at Emmanuel Hospital and then later with the other program, um, I went and I visited those centers to see what they were doing compared to what we were doing and to try and understand the range of things they were doing to support women and their children, because they would involve the children in the mechanism of trying to get life back on track rather than keeping it completely separate, keeping children completely out of it. And they were beginning to look, and because it was in Boston, they were beginning to look at the issue of fetal alcohol
How long ago was that, Antonio?
in the 90s. The 1990s.
So
It-
20 years after the discovery.
and now we're way more than fetal alcohol syndrome was named in 1973, and we're a lot of years past that. I had a young woman move into my neighborhood a couple of months ago who was house sitting, young single mom with a 6-week-old baby, who's house sitting one of our neighbors. I live in Alaska, and one of our neighbors houses for the winter, and she and her new baby. And one of my other neighbors was talking to her and telling her about the people in the neighborhood, and who she's going to want to meet, and you can go to this person for this and that kind of thing. And she mentioned my name, and she talked about I was very involved in fetal alcohol spectrum disorders, and this young woman said, "What's that?" And so we think that this information is widely known. It's really not. Well, and so my friend, who's an emergency room nurse, started telling her about, and she said, a woman's face as she told the story. There's some support work we're going to need to do there, because she said, "I've
Everything changed.
The
heard."
color just drained from her face, right?
Yeah. Yes. And so she's holding this beloved baby, and face has gone pale. And so we will provide support, but it is atrocious that she's never even heard it. Like her doctors, her nurses that she worked with didn't help make sure that she was staying sober, didn't help explain it. She's never
Well,
even
they don't ask.